My name is DustiMay Howard. We're here at Beverly Hills for Dr. Schwartz. I'm 40 years old. I'm a transgender female. I've been, transitioning for the last 4 years. I found him online. I was looking for plastic surgeons in the LA area that had experience with transgender patients, and there were several doctors that I was able to find, and I just felt more comfortable with Dr. Schwartz. Any anxieties or anything like that were just like gone in like 5 minutes. To me, he shows and exudes, I guess you could say, confidence in his knowledge and ability. He has a number of years of experience behind him. He's answered every question I have. He hasn't made me feel like I needed to rush or that I needed, any way to kind of hurry up, or that he was in a hurry to get somewhere else or anything like that. He took all the time that was needed and made sure I felt comfortable, which was great. There was no question he couldn't answer, and the questions that I knew or had a general idea of already, the answers he gave lined up really well with what I knew and filled in a lot of the gaps. So I'm getting breast augmentation and a mini tummy tuck because I didn't have kids, but bitch got bad. Yeah, I got a little large, lost some weight, and so now I can't lose the skin. I had a separate consultation actually for each also, so it wasn't all in the same one. And we went through all the different options for the breast augmentation, and once I was done with especially the breast augmentation, I had some of my own thoughts and reservations, could this leak into me? Could this hurt me? Could this, those types of things that I had concerns about. And he was able to show me right there with the product and address those concerns to the degree where they were no longer concerned. I like that he pretty much mandates that you have to have the surgery insurance, so in case anything goes wrong, it's paid for by that insurance. And so those things right there too makes me feel like even more confident in his abilities and relaxed. It's just under a week and a half. On December 10th, I need to report to the surgery center I need to be there by 7:30, so I'll probably be there a little earlier. And that's for both breast augmentation and the tummy tuck. And I anticipate to have drains for the mini tummy tuck, and coming back the next day. The staff have all been helpful and friendly. Everyone's been patient, and I haven't seen any signs of, oh, this bitch, shut up, no kind of nothing. Well, it's going well. I haven't had any complications at all that I'm aware of. The surgical incisions are healing up nicely. I have feeling in all area, my boobs and where the mini tummy tuck took place. No pain and in either the boobs or the mini tummy tuck. And the mini tummy tuck, it felt tighter, and so I was careful about how I stretched and things like that. I'm not really feeling or detecting any thick scar tissue or anything like that. And I haven't had to call Dr. Schwartz at all, or the office for any kind of oh my god, this happened, I need this fixed. No, I didn't need any pain meds other than I took ibuprofen, but I didn't care to take the Tylenol. Didn't do anything. It wasn't as bad as I expected. I went to work week after the procedure. I kind of wish I would have stayed off of work for like another few days because of the mini tummy tuck. That's what caused me the most, like, to be slower and kind of like have to take a lot of time was the mini tummy tuck. The boobs were good to go after a couple of days. Yeah, they were lots more comfortable, especially after the first night. And I just made sure to massage them and do what was told. And I'm like 5 pounds heavier than when I came in for surgery, 5 to 10 pounds. And, but I don't feel fat at all. I don't care that I gained it, because I look in the mirror, I like the way I look. You know, and the contouring, that was one thing I couldn't stop like looking at in the mirror, even when I was swollen. And I would take the binder, like especially when I was able to take the binder off the first time I take a shower. And I was looking, and even though I was swollen, you know, I didn't have all this extra fat, or well, not fat, but skin, just like mushroom there. And it wasn't a muffin top, it was kind of more of a mushroom top, depending on how I sat. And that was gone, and you know, I could tell it was tightened up. I love my belly button now. I love my belly button because it was pulled down a little bit. I hated it. Before, it was like I got shot in the stomach. I mean, like I could stick that much of my finger in my belly button. And now, since it was pulled down and kind of stretched a little bit, it makes it look like narrower, and it doesn't look like it's like a cavern. And so it looks like a cute little belly button. I love my belly button now. I hated it. And then the sides, I was after I took it off for the first time, I'm like, ooh, I got curves, because not only was the excess skin taken off, but there was the body contouring liposuction that he did in the front, sides, and back to help give me that hourglass figure. And I could really see it when I do like little twists and moves and stuff. And I was doing that in the mirror, and it's like, oh shit. I mean, like, I look at my boobs, and I'm like, my boobs are great, okay, there's nothing wrong with them. And it's like, curves, damn. And I just forgot all about my boobs, and I'm like trying to like twist, and it's like, ooh, don't twist that way. Okay, not yet. And then, look at that. Yeah, like every time for like weeks, when I would go take a shower, because I have a huge mirror beside my tub, and I would stand there probably for like 5-10 minutes, like looking and trying to be careful not to hurt myself. Everyone loves them that sees them, and I show them to the people enough. They love them. They're like, it's the best boob job they've seen. And then when I tell them I haven't had any pain meds and all that, they were all like, oh my gosh, really? And it's like, yeah, I got this surgeon down in Beverly Hills, so if you need one, I definitely have recommended Dr. Schwartz to other people. And yeah, I can't find any really negative thing to comment on or that has come up. There's nothing that I can think of where I've never been uncomfortable. I've never had any, I guess maybe the doubts or questions I had going in, because it was my first like major surgery like that. I mean, I had my tonsils out, but something like this was longer and such. But you know, it's like, how would I react to the anesthesia? Going to the surgical center was nice. I liked that place. It was really nice. I was walked through every step of the way. So even though I had some unfamiliarity concerns with what's going on, those concerns were alleviated as we went because I was being guided along the way. I didn't feel like I had to figure things out on my own. And then always available. I haven't really, I think I texted a few pictures maybe to the text phone or whatever. But the only time I ever did text was like, okay, I did this, is that wrong, or did that hurt? Or is that, you know, it kind of hurt a little bit when I stretched this way, is that okay, did I hurt something? Every time, you know, a response back, you're okay, you're fine, and, you know, does it look like this? If it looks like this, you know, then that's when you really need to give us a call. And every time, yeah, it was just like that, no problems. I feel more complete and better about myself. So yeah, I have fun with my boobs, and I'll what's that? I think it's called, I'm a tease, and I love attention. So just put that together. Okay, I got a crop top mesh shirt that I'm wearing to roller skating tonight. Love boobs. So yeah, I'm definitely having fun with it, but the confidence, the way I feel about myself, the way I see myself in the mirror, and my own perceptions and thoughts about myself are so much better than before. And they were just distracting bad thoughts before. Now it's You know, yeah. So the fun is there, but I mean, it's so much of a small thing compared to how it made me feel.